sir. My name's Kate. I'm going to be the nurse practitioner. I'm doing your cardiac, respiratory, and peripheral vascular exam today.
Okay.
I'm going to start by actually having you lay down, if you don't mind.
Sure.
And while you're lying down, we're going to start with the cardiac portion of the exam. While you're lying down here, I am inspecting a couple of things, and like we're going to see as a pattern throughout this exam, we're doing these at particular anatomic locations. And so I am looking for any heaves in the following locations. In the second intercostal space along the sternal border, the left sternal border, we're looking at the aortic area. Across from that, again, second intercostal space along the left sternal border. Did I say left for the sun?
You said
Right? Right for aortic,
and
left for pulmonic. And then moving down between the third and fourth intercostal spaces, we are looking at Erb's point, down on the, again, along the left sternal border, and then along the left sternal border, along the fifth intercostal space, we're looking at the tricuspid area, and then we'll scoot over again along that fifth intercostal space, and the midclavicular line, we're looking at the mitral area. So again, I said we're looking for any heaves, which are areas where the chest is lifting up in those areas, and then we're going to palpate those same areas, feeling for any thrills over those areas that could indicate turbulence of blood flow or a murmur or regurgitation. So again, aortic, pulmonic, down to Erb's point, and then tricuspid and mitral. While I'm over here, the mitral is also the apex of the heart, that area, and so that's where I've got our point of maximal intensity, which point of maximal impulse, which I can feel here very easily. I can't actually see it visually, but I could feel it. And then we're going to auscultate over those same areas, first with the diaphragm of my stethoscope to listen to the heart sounds in those areas, and then we'll switch to the bell to listen for murmurs. So starting with the aortic and pulmonic, Erb's point, tricuspid, and mitral. And over this mitral area is where I would listen for an apical heart rate as well. And then we're going to switch to the bell of the stethoscope. Again, same areas, so aortic, listening for murmurs. Pulmonic. Erb's point. Tricuspid. And mitral. And then I'm going to just come back to Erb's point for you because I think that I heard splitting of the S2. So I'm going to listen over Erb's point again where I can hear the best heart sounds. And I'm going to have you ask you to take a deep breath in whenever I say, okay? And a nice deep breath, please. And let that out. Good. And so we can tell that that's a normal anatomic variant for you because the volume of the splitting actually gets louder when you take a deep breath in. So that concludes the, oh actually no, I almost forgot to check for jugular venous distension. If you could just like kind of scoot down maybe a tiny bit.
sure.
And I would be using some tangential light here, and if you could turn your head to the left, please. And I'm looking for any jugular venous distension. I do not see any. I can see the pulsation of your internal jugular vein here. And so I would measure that by getting a straight edge, maybe a tongue depressor or something to that extent, and then a ruler so that I could measure to the point of maximal impulse where we see that there. All right, great, thank you very much.
Sure.
We'll go ahead and have you sit up so that we can move on to the peripheral vascular portion of the exam. And this is really just checking to make sure that, you know, we were looking at the main portion of your heart there, and now we're going to be looking at the kind of more distally. The other thing I forgot to mention about murmurs is if we were to have heard a murmur over, for example, the aortic area or the mitral area, we would want to document the location, the timing, the intensity, the quality, and we want to grade that murmur about how loud it is based on how loudly we can hear it with our stethoscope or maybe even without our stethoscope touching your chest. And then we would also want to check for whether or not that radiates. So for example, the aortic valve, if we had a murmur there, we would listen at the carotids to see if we heard radiation to the carotids. And if we noticed a mitral murmur, we would listen under your left axilla to see if we heard any radiation over to that area. Okay, so again, moving on to the peripheral vascular portion of this, I'm just going to check both your arms and your legs and feel along them to make sure that the temperature is warm and you are warm and well perfused, checking for capillary refill, which is just fine. We're having good blanching and a brisk return of color to your nail beds. I'm going to feel your radial pulses here. And then same thing on your legs. So again, feeling that we have the same temperature kind of as we move down. Again, warm and well perfused. Checking for, oh, thank you for scooting forward there. Checking for your pulses, popliteal pulses bilaterally. And then moving down to your dorsalis pedis pulses on the anterior aspect of the foot. Again, bilaterally. And then to your posterior tibialis on the medial aspect of the ankle. And that's great. I'm also checking for edema while I'm down here, most particularly around the ankles, along the tibia there, and I'm not noticing any edema at all with your legs. And so now we'll move on to the respiratory portion of the exam. And I'll actually start by auscultating. So if you would mind sitting forward and maybe turning, actually, why don't you turn a little bit this way? Okay. That way the camera is angled correctly. And we're gonna start auscultating at the bases. We've got to switch back. I still had it on the bell there. So we're using the diaphragm of our stethoscope for this. And so when you feel the bell of my stethoscope hit your back, if you could take a nice deep breath for me, okay? We're going to listen in two more spots here, right here, in this little fossa here. Good, and here as well on the other side. And then if you wouldn't mind lifting your arm out for me. And likewise on the other side. Great, okay. I'm going to listen on the front too, just in two areas here so we can get the middle lobe, particularly on your right side. We'll listen on the left as well. Great. You okay? That was a lot of breathing. Yeah. Okay. All right. I'm going to move on to percussion to give you a little break from all of the breathing there. Okay. So we're going to do the same thing, working from the base of the lungs up to the top in those three areas on each side here, making sure to avoid the scapula bilaterally here. Got appropriate resonance there. I'm going to come and do the same thing over in your the bilateral fossa here in your neck. And then under your arms again, if you wouldn't mind lifting here. Good. on the other side here. Again, good appropriate resonance throughout there. I don't hear any dullness or any hyperresonance as well.
Okay.
Now we are going to move on to checking your diaphragmatic excursion. So I'm going to place my hands on the bilaterally on your back, and I need you to take a nice deep breath in. Good. I'd say maybe about 5 centimeters of diaphragmatic excursion there, which is perfectly appropriate. And while we're back here, I'm going to check for your equal chest expansion as well. So I'm going to kind of compress the skin of your back a little bit here with my hands angled towards your armpits. And if you could take a nice deep breath in. Good. Yep, nice and equal chest rise and fall there bilaterally. I don't hear any adventitious breath sounds throughout. You can go ahead and relax there. Any adventitious breath sounds throughout. No wheezes, certainly no stridor, no rails, no crackles. All looks well. Are you having any difficulty with your breathing?
No.
I know you have a history of asthma.
Correct.
And you take your medications appropriately for
Yes.
that. Okay, all right. That's about it. Oh, I almost forgot about listening to your vocal resonance. And so if you would mind actually turning back around. Sorry about that, sir.
No problem.
I'm going to have you repeat the phrase blue balloon when you feel my hands on your back. I'm going to do both sides at the same time with kind of the, I guess the medial aspect of my hands here.
Okay.
Blue balloon.
Blue balloon.
Good.
Blue balloon. Blue balloon.
If you would mind raising your arms out. Same thing here.
Blue balloon.
Yep. And also right here again.
Blue balloon.
Great. And very nicely done. You turn face forwards again here. Again, I'm noticing, just as we did with your head and neck exam, that your trachea is midline. And I'm not noticing any your use of any accessory muscles when you breathe. Certainly no retractions, no nasal flaring. All looks well and comfortable.
Great.
Okay, well, thank you so much for your time today. I really appreciate it.
Thank you.